Alrighty, everyone. Thanks so much for joining us today for our speaker series. We're going to be talking about all things detoxification, immune health, and your thyroid. While we're letting everyone get settled in, and let everybody kind of roll in here before we get started. A little bit about Paloma Health. So my name is Alex Ruiz. I am the Director of Content and Community here at Paloma Health, where we specialize in hypothyroidism and Hashimoto's. Now, for those of you guys that don't know, Paloma Health is a full service online medical practice. We are not just a test kit provider, even though that is definitely something that we do. We are really proud to say that we offer a very affordable full panel thyroid testing kit that you can do in the comfort of your own home. But we are 100% more than that. We are an online medical practice. So we have lots of providers like Daniela Gerard, you're going to hear from today, as one of our providers to provide you full treatment plans, care, medication, refills, medication options, changes, all of the things that basically go into thyroid treatment and finding out what's best for you. We really pride ourselves on being kind of holistic and functional focused and really like to look at the whole body approach, because at the end of the day, we know that medications is only a part of the solution to helping you feel better. It's so much more than that. It's so much more about a mindset shift. It's about your nutrition. It's about your lifestyle, stress management. And all of our providers really focus on the whole body, the whole aspect of things that can really be, making a difference and impacting your thyroid health. So with that being said, we also have an app that is free. We service here in the United States, and you could do lots of numbers of things. You can track your symptoms, which is honestly one of our biggest features, and people love that. It really gives them a clear idea of if they're making progress, day over day, month over month. Not only that, we have a bunch of meal plan options. We have exercises, we have yoga, meditations, like sound, noise, like all these different options that you could do to really help your lifestyle. Because again, thyroid health is not just medication and that's it. It's really helping you implement the best lifestyle to help promote your best thyroid health. So without further ado, I think we're going to go ahead and get started today. So today in our speaker series, we're going to be doing all things detoxification, how that impacts your immune health, how that all relates to your thyroid, Hashimoto's, hypothyroidism. And without further ado, we have our two guests today. We have Dr. Daniela Gerard, who is one of our providers here at Paloma Health. And then we also have the one and only Mary Shomon. She's the OG thyroid advocate and one of our consultants here at Paloma, who I'm just so honored to be working alongside with. So Dr. Gerard, she is board certified in emergency and functional medicine. And I'll go ahead and kind of let her take it away, tell you her story about how she got into thyroid treatment and some of her hobbies and such and where she studied. So Daniela.
Thank you, Alex, and hi, Mary, and very happy to be here. This is my first speaker series, so bear with me, and hopefully, my mouse won't get ahead of myself. So, like it has a habit of doing. But anyway, I am originally from Romania. So in case you wonder about my accent, that's everybody's first question as soon as I open my mouth. And my husband has forbidden me to get rid of my accent. So I'm stuck with it. I went to school in New York and for my entire undergrad in electrical engineering, and then my MD and PhD in cellular molecular pathology. And, back then I was very excited about emergency medicine because you could do everything and see all the ages and everything else. And in the course of practicing emergency medicine over many, many years, I became more and more frustrated with how little I had to offer some of the patients and how many patients presented with similar symptoms that we didn't really understand what was going on. So, and we kept saying, oh, it's stress, oh, it's this, it's that, but not having really real answers for them. So that's how I discovered functional medicine and essentially found my tribe. And endocrinology had always been one of my first loves, so to speak, because I did my undergrad research in that. So, and I always thought endocrinology was fascinating because of the feedback loops, and the engineering brain kind of fit really well with the way the glands work. And thyroid in particular, because it's not a straightforward cookie cutter, you have to actually think through, and each person is different. You have to take everything into account when you try to figure out a personalized precision medicine approach. So, in the course of the functional medicine, I came across Paloma and thought, wow, this sounds like a lot of fun, and it has been. So, thank you guys for taking me in and giving me this opportunity.
Yeah, well, here you are helping our community of thyroid people, just helping them feel better. And I totally agree. Like I said earlier, doctors really focus on a personalized whole body approach. And I think just in general, endocrinology is one of those specialties where you have to take all of that into consideration because, like you said, the feedback loops, the hormone and fluctuations, especially as women, we just go through different hormonal periods and it all intertwines. So thank you so much, Dr. Gerard, for being here. Next, I'm going to go ahead and introduce, you guys know her already, Mary Shomon. She is the thyroid advocate, author. If you haven't read any of her books, she has several books. She has been on the scene since the 90s, right? She's just been in the thyroid space advocating before I feel like advocating for thyroid was even a thing. So without further ado, Mary Shomon.
Thanks, Alex. And I'm so excited to be here with you and Dr. Gerard. And I think this is going to be a great topic to talk about detox because that's such an issue for so many people with hypothyroidism and especially with Hashimoto's because we're just, we're out there swimming around in toxins all the time, the food, the water, the air, all the things that we're exposed to, even the energy that we're dealing with is toxic in some cases. And exposure to all sorts of things. So it's a subject that I feel really strongly and passionate about. And as you said, a lot of folks know me, but if you don't know my story, I've been diagnosed since the mid 90s. And back in the day, as we say, the answer was, oh, just take your thyroid medicine and you'll be fine. And I quickly discovered that wasn't quite the situation. And unfortunately, even since then, things haven't changed as much. There are a lot of doctors and a lot of medical practices that just view it as, hey, take your thyroid medicine and we're not going to worry about anything else. Everything else you need to deal with yourself, which is why I'm really excited to be helping Paloma and working with Paloma to help really expand the concept that a good medical practice focusing on hypothyroidism care needs to focus not just on the tests and the medicines, but also the other issues, the lifestyle issues, supplements, nutrition, and all of the factors, including the exposure to toxins and how we can get rid of them, which is going to be the topic of today's conversation.
Thanks, Mary. Yeah, I think one of the biggest things just in the thyroid space is, right, this misconception that medication is going to make us feel better. But there's a lot of circumstances where people with Hashimoto's don't necessarily have hypothyroidism and medication isn't really an option for them. And so they have to look at to other factors such as lifestyle factors. And we know, liver health is a huge thing. Toxic burden is a huge thing that we talk about. Stress, just constipation. A lot of people struggle with that. So Daniela, it's kind of, just jumping right in. For people, I guess, that don't know, because I feel like detoxification is such a buzzword that it could be hard to be like, what does it mean? What is it exactly? What is the purpose of detoxification, or how would you describe it to someone? And what organs and tissues, I guess, really help support this function of our body?
Sure. So, like Mary said, we are assaulted by toxins day in, day out, from inside and out. And, from the environment, from our skincare, from the moment we get out of bed, even the soaps that we use, the toothpaste that we use, what we put on our skin, on our skincare, our makeup, everything from there on. Of course, what we put into our system by eating, the foods that we eat, the things that we drink, and then we get out, the air that we breathe, everything impacts our system, and our body is equipped to really handle a lot of it. It's just that when it gets to a certain point where we overwhelm it because there are so many toxins, that's when it becomes a toxic burden, as you said. And that's when we need to do something to help our systems get rid of it. And there are a lot of different ways to do that, and a lot of ours that we have a few different systems that help us detoxify. So, starting from the sweat glands, also, I should mention that a lot of these systems can be impaired in people with hypothyroidism. So it makes it even more challenging, which makes detoxification even more important as a purposeful, mindful, intentional thing that we need to do at least periodically, as well as some things that we need to do on a continuous basis to continue to get rid of the toxins. In addition to that, we also have our own toxins that we make through processing our own hormones and everything else. So that also contributes to the toxic burden, especially if some of our detoxification pathways, the way our body detoxifies, are impaired by the disease process. So main organs that help us in detoxifying are the skin with the sweat, which we know in people with low thyroid can be impaired. So that can be a problem. The lymphatics are very helpful in helping us get rid of toxins and pushing them, bringing them into our venous system so that our liver and our kidney can take over and get rid of toxins, as they are two major organs that our body uses for detoxifying. And then, of course, the gut is a major way, because the liver prepares the toxins to be expelled, but of course, it has no way to literally get them out. So the way you get them out is through the stool or through the urine from the kidney. So those are the main ways that our body has to do that. If any of those along the way become impaired, we really need to do everything in our power to clear that out, because otherwise, think of a plugged sewer system, so to speak, get stuck there. And if you don't move them, the stink and the toxins kind of move, and things can actually get back into the body by retoxifying some of the things that the liver detoxified if we're unable to get them out of the body.
Right. Yeah, things like, leaky gut, for example, is something that people really struggle with. They end up having like a hole in their gut intestinal lining, and that's where toxins from your food that would normally get processed can end up seeping through, and you can actually experience a lot of issues like brain fog, for example. You could have a lot of food sensitivities build up. So Mary, besides like the leaky gut that we talked about, Daniela brought up a lot of different systems in our body: our kidneys, our liver, our sweat glands, our skin, our lymphatic system. Our lungs also detoxify. They clean the air for our bodies. Like, that is such a huge one. There are so many different symptoms, I'm sure, and signs of toxicity buildup in our bodies, right? That can kind of let us know that we need support. Can you kind of give us some insights into just different signs and symptoms that potentially people can look for?
Sure. Well, the interesting thing is that some of the signs and symptoms that you're in toxic overload, or you have too many toxins and too much exposure to toxins, are very similar to symptoms of hypothyroidism. And so we'll see people feeling very sluggish and not moving quickly. The skin cannot look clear, and you can get dry skin or imbalances between the oiliness and dryness. You can have constipation, feeling like the bowels are sluggish and not moving quickly, feeling like it takes a lot to have a normal bowel movement. When people are in toxic overload, they can feel like they have difficulty with sleep issues. Sleep can be disrupted. You can have joint and muscle aches and pains because toxins can kind of concentrate in the joints and muscles as well. So, and the inflammation in the body can cause joint, muscle, and nerve and tendon pain as well. We can also feel brain foggy and fuzzy because it's slowing down the clearing process that lets things work well. And thyroid is a slowdown. This is a blockage of those same pathways and processes. So again, I feel like there's a lot of crossover symptoms. So it's not always easy for someone with a thyroid condition to know specifically if they have a toxic overload. And the symptoms may be there's so much crossover that you might have to say, you know what, I'm going to do some things to make sure that I'm detoxing my body gently overall, whether or not I can identify whether my sluggishness is coming from my thyroid or a detox pathway problem or both. I'd be interested, Dr. Gerard, do you have any thoughts about that too?
You mean about the detoxification?
Well, the idea of the symptoms being a very, having certain degree of crossover. Did I miss any symptoms as far as you're concerned that you see regularly?
No, I think you're correct. It's very non-specific. And it's actually similar not just to hypothyroidism symptoms, but also, symptoms of hormone imbalance, symptoms of gut problems. There's a lot of overlap because the body has a limited repertoire of how it can respond to insults. So because of that, it only knows to do certain things to let us know that something is wrong. So one of the, I think you pretty much covered most of them. And that's why it's really important to kind of tease out what is going on and how much is because of the symptoms or how much is because of toxic burden. That being said, there's the feedback loops go forward and backwards. Everything is interconnected. So you take one system out of balance, you've taken a lot of other things out of balance. So trying to bring it all back together into balance is what's going to restore the health and wellness.
Good point. Thank you.
Yeah, I think there's a lot of, in general, we know that hypothyroidism has a lot of similar symptoms as other conditions like depression, for example. A lot of mental health conditions, people end up getting assumed. Menopause, unfortunately, people always get overlooked, for instead of actually being diagnosed with a thyroid condition. And I think that's why awareness is always the biggest key when it comes to these things, because maybe you don't realize that, having a bowel movement every other day is actually not normal. And we need to be having like 1 to 3, let's say, per day for, I guess you could say, optimal release in that way. Another thing that's like really big, is liver health, which we know there's a lot of connection, especially when it comes to the T3, T4 conversion. Something that I want to talk about specifically with liver health, which is obviously one of our, detoxing organs and everything, is something that's really, really high on the rise right now, which is non-alcoholic fatty liver. And we actually know that a lot of patients who have conditions like hypothyroidism and Hashimoto's not only have a higher risk of developing that, but in general, more than likely, they have what's called a sluggish liver. So Daniela, can you kind of give us some insights into what a non-alcoholic fatty liver is? I mean, what causes it exactly? And why do we think it's on the rise? What can we do to support it, especially when it comes to our thyroid health?
Sure. And the non-alcoholic liver is definitely on the rise, at least in my experience. And the reason it's called non-alcoholic liver disease is because until, the last probably 2 decades or so, or even the last decade, most of what we were seeing was alcoholic liver disease. That's what we knew most about. But then we started to see more and more liver disease and cirrhosis and end-stage liver disease in people who never touch a drop of alcohol, or will have a little bit of alcohol, but definitely nothing excessive, maybe once or twice a month. So that's where the name of non-alcoholic fatty liver disease actually came from, because in the medical community, we were mostly used to alcoholic liver disease, and the first thing you thought of if you saw somebody with liver disease was alcohol. So, but basically the heart of non-alcoholic liver disease is fatty liver. And there is one form where you don't have inflammation and one form that you have inflammation, which is a later form. That's the ones that can lead to cirrhosis and liver cancer and the much more advanced problems. But the fatty liver, we hear that all the time. And, we used to shrug it off because it's like, oh, you have fatty liver, which really didn't say much because we started seeing it in more and more people as we were doing more and more ultrasounds, more and more CAT scans. So we are able to image things more and see things better. And so that's kind of how it came about, that it seems to be on the rise. So I don't know how much of it is truly on the rise or we're seeing it more, because we do have these modalities of assessing for it and looking for it. But we're even seeing elevation in the liver enzymes, which we were able to see before. So I think it is more than that. And in large part, that is because of excessive sugars. It's because our SAD diet, the standard American diet, a lot of the things that we take in, a lot of the fried foods, a lot of, and then like we talked about, the toxins that attack the liver from every which way. But one of the main things is excess sugar, because once the liver stores a certain amount, it also turns the sugar into fats, and to really simplify it, and it becomes storage for it. So, and the more it stores, the less it's able to do its job over time. Then it starts developing fibrosis. So that's how the cirrhosis starts forming. So, I don't know that we know exactly what particular thing. I think it's a combination of things that's causing the non-alcoholic liver disease, but it starts with fatty liver, and then it deteriorates from there.
Maybe for those that don't know, can one of you kind of talk about the importance? I mean, all of our organs and everything are obviously have great importance to our whole body, but can you specifically talk about the connection with the liver and how that impacts our thyroid health? I mentioned, very lightly about the T3, T4 conversion. I mean, how does poor liver health, relate to, I guess you could say, poor thyroid health?
Well, if you want me, I'll just kind of then I'll let Mary take over. But basically, the liver is responsible for a large part of the conversion of T4, which is the inactive form, to the T3, which is the active form, which is what we actually need to feel the thyroid hormone. Because we can have a lot of T4, but if we don't have T3, we're not going to feel well. The thyroid hormone is still not going to do its job, because it's really the T3 that impacts the receptor and improves the symptoms. So if the liver is busy with so much detoxification and it's burdened and clogged with the excess fat, then it's not able to do its job properly. And so it's not able to do as much of the conversion. So we end up having the T4, but not really having the T3s that we need. And it's fine, because having the T4 will actually decrease the TSH. So the brain thinks, oh yeah, we're having the thyroid hormone, but because the T4 has a bigger impact on the TSH than the T3, so it's not feeding back to making more T4. So, in my mind, that's the main way in which the liver impacts the hypothyroidism, and along with many other processes, but just to relate it back to the thyroid hormones.
Mm-hmm. Mary, can we touched lightly about like gut health? Can you kind of talk about the importance of, I mean, overall gut health, but why constipation is such a struggle and how that can also impact thyroid health?
Sure.
And yeah, with people with Hashimoto's and everything. I mean, I know constipation. You even mentioned earlier, like lack of sweating, which is just, our sweat glands, lymphatic system, everything is just impaired dramatically. Like, how does that affect our thyroid health?
Well, anytime we are slowing down those detox processes, we are reducing the amount of toxins we're getting out of our system. So, as Daniela mentioned earlier, thyroid patients don't sweat as easily or may have an impaired sweat mechanism. So, we can't sweat out toxins as easily. Thyroid patients may have, gut issues that give us a leaky gut, which means that we're not as good at filtering out toxins from the food and drinks we eat. But one of the processes, or one of the places where detox is also taking place, is in that elimination system. So we're taking in certain things. Our body is filtering out. If it's working well, it's filtering out some of these toxins, and some of them are going to be eliminated through our bowel movements. But if that bowel movement is moving slowly, or in some cases not at all, in the form of constipation, that's leaving it longer and longer time frames to sit in our intestinal system, in the colon, et cetera, where we're able to be exposed to those toxins for longer periods of time. In a healthy body, we're going to be taking food in, getting all the nutrients out of them as quickly as we possibly can, processing it. We have a liver that does what it needs to do with glucose and glycogen, and then the food moves on. The toxins have been separated out, and they move, swiftly through our digestive system and are eliminated. But with a thyroid patient, where everything in the body depends on the energy and oxygen that thyroid is helping our cells, tissues, glands, and organs get, when that process slows down, that just increases our toxic burden. It increases the time we're exposed to the toxins, and it slows down the speed at which we're getting rid of them, which just makes it, it becomes just a continuing process of like sort of bailing out a boat that's leaking, and you got to keep trying to get rid of the toxins, but they're still filling back up again. And you're never getting to a place where you're cleared out, on a toxic level, not just on a constipation level, but on a toxic level in general.
Can you kind of walk us through, I guess you can say, just, we can kind of talk about this more in depth, but I mean, what would be kind of the best thing to tackle first? Would it be gut health? Would it be liver health? I mean, should we focus on trying to sweat every day? If someone had to pick one, I guess what would be the priority for you guys? What do you feel like makes the most impact when it comes to our thyroid health?
To me, it's gut.
Go ahead. You go first.
Rock, paper, scissors for it.
Daniela, you go with it.
Well, to me is the gut, because until you fix the gut, and honestly, the gut and the adrenals to me are the most important ones, because until you fix the stress, so you take some of the load of the adrenals, which is just an aside because it's not really related to detoxification, though the stress is. But then the gut is hugely important, because like you said, constipation is a major problem, because we can't get rid of the toxins and things aren't moving. And at the risk of being boring by being too technical, there are 2 stages of detoxification that the liver goes through, and it makes the toxins that the blood brings to it, it puts them through these 2 stages to make them able to be eliminated either through the stool or through the kidney. Now, if they sit around in the stool, we're exposed to them for longer. So they can do damage. They can do damage to the gut. They can do damage to the microbiome. They can do damage to the gut lining, and increase the leaky gut. But furthermore, they start to break down again and get back into that toxin form from before they went into the liver. So now they're going to go back in the circulation, recirculate, put more burden on the liver because it has to detoxify them again and try to get rid of them. And, as I'm sure everybody is aware, if you're not having a bowel movement for a few days, you become very, very uncomfortable. And it's not uncomfortable just from the bulk that is there. It's uncomfortable on many different levels. It's painful, but you just feel sick. You don't feel right. So really trying to eliminate is very, very important. And, one of the teachings of functional medicine is when you have a lot of symptoms and you have a lot of issues and you don't know where to start with the gut. So once you fix the gut, a lot of the things kind of start falling into place little by little.
I would add too, for patients who aren't really sure, I think starting with the gut is a wonderful idea. I would also say start with things that are easy to accomplish. For example, we're talking about helping you sweat. And yes, exercise is a great way to sweat, but so is a sauna. So is a good hot bath. So is, using a far infrared mat. These are a lot of different ways. So, even if somebody said, you know what, every night I'm going to start taking a really good hot bath with some magnesium oil in the water to help draw out some toxins and things, that's a good thing. Kidneys are a big detox organ. Water is essential. We need lots of clean water to help those kidneys function well, and water helps us process out those toxins. Even if you say, I'm going to increase my water intake, the lymphatic system is really important, and gentle exercise, walking is a lymphatic exercise. Getting on a little rebounder or a trampoline, if your kids have one in the backyard, is a great way to do this. So even if you say, hey, I'm going to start walking a little more, drinking a little more water, and making sure I get a hot bath on a regular basis, those are all detoxifying steps that you can take that are actually in many ways quite pleasurable. They're not big burdens, they're not horrible things to do, but they actually have benefits not only for our general well-being, but they have benefits from a detox standpoint too. So I would say, just on a purely simplistic level, pick a few detox activities that you like to do, because they're going to be good for your health in general, and they're going to help your detox process as well.
I think that's definitely something that, a lot of people get overwhelmed with. I have to do this and this and this and have to implement this new habit. And, there's a lot of methods that work. I like what's called habit stacking. So adding a new habit on a habit you already have. So that way you do it immediately right after that. And that's an easy approach for me anytime I implement something new. But I think people, try to go for the really complicated things when things such as going for walks more, which is a really easy thing to do for most people, right, is something that we can implement a lot easier than, let's say, getting an expensive membership to go to a sauna 3-4 times a week, which, might be out of reach for a lot of people. So I think, for if there's anything to take away from that, it's, try to do the easy wins, see if that makes progress. And then if not, like with your thyroid care, then we need to dig deeper and kind of find this like root cause. I wanted to kind of circle back because, we want to talk a bit about immune health in this discussion. And, there's a lot of people that say Hashimoto's is more of an immune system problem versus a thyroid problem. And, there's a lot of debate, I guess you can say, about that. But at the end of the day, it's an autoimmune condition where it's attacking your thyroid gland, right? Hashimoto's hypothyroidism, for those that don't know, is just more of the underactive form of your thyroid actually producing thyroid hormones, whereas Hashimoto's is the attack itself on the thyroid gland. So with that being said, how does detoxification, I guess, support or inhibit our immune system? Are we more likely to get more sick, more like coughs and colds? How does that affect that? And because Hashimoto's is an immune system issue, I mean, can we see our antibodies increase if, let's say, like our lymphatic system is clogged up? If, the more constipated we are we going to see our TPO antibodies skyrocket? Daniela, what are your thoughts on that?
That's an interesting thing, and I don't know the studies on that too. I mean, but I'm trying to think if I've seen anything about the antibodies actually going up, but from experience, the antibodies go down after detoxification. However, one of the things I tell people about when I do detox, and I do detox at least twice a year with a lot of my patients, an actual, in addition to the easy things that hopefully they do on a regular basis, but an actual specific 7 to 10 day detox once or twice a year. And it certainly improves the immune system because it gets rid of a lot of toxins. And you mentioned leaky gut before. So one of the ways leaky gut, it's actually you have these holes in between the cells. So you're not regulating through the cell channels what goes in and out of the cells and what goes from the gut into your system. So now you're going to get things that stimulate the immune response and makes autoimmunity worse. So, so when you detoxify, initially you may feel a little bit worse because you're pulling a lot of toxins. And again, if you don't eliminate those toxins, you're going to continue to feel worse. So that's why it's so important to drink a lot of water and to do everything you can to eliminate. But after the detox, you're actually going to see hopefully a decrease in the antibodies and an improvement with the of the thyroid function, as long as it's not fully previously destroyed by the Hashimoto's. So, now we're getting into a lot of nuances as far as, between Hashimoto and hypothyroidism. But from a Hashimoto standpoint, it makes sense to me that the antibodies would decrease after the detoxification because you're able to eliminate more and the immune system is able to actually work better and hopefully turn off some of the pathways that had increased that autoimmune response.
So to kind of piggyback off of Dr. Gerard's comment about how, she puts her patients on, let's say, 1 to 2 detox protocols per year. We did talk about some easy ways already that we can detox better at home, right? Rebounding, I absolutely love that one. Simply walking, you could jump up and down at home, go to the sauna, take a hot bath, drink lots of water, do all those things. But, is detox protocols, and for either of you, is a detox protocol necessary for everyone? And at what point would you say it would be necessary for people? And kind of what are the steps for that? I mean, where do you really focus when you say a detox protocol? What does that mean for people, let's say, who don't know?
Go on, Mary.
Oh, well, I'm not the doctor on this one, so I can't really say how often people should do detox, and I do feel like people should incorporate as many sort of detox practices and lifestyle choices into their system, because to do a detox, especially for a first timer, can be a little bit rough. I mean, Daniela was talking about, having to kind of watch what you're doing with it. And I'm always like an advocate of telling people to go gently, because, there's something called a Herxheimer reaction, where if you detox too quickly, there's die off of bacteria or die off of yeast, or a very rapid extraction of the various toxins. And so you end up in a short-term period of a toxic overload, which can cause all sorts of symptoms. So people will say, for example, they go on a candida detox to get rid of yeast overgrowth, and they have such fast response and such heavy die-off that they actually feel worse for a few days or a week or so, and they'll say, this was a mistake. So I think people need to be prepared as they're going into these processes so that they know what they're doing. So ultimately, I guess my point is, detox is not a do-it-yourself. If you're doing a formal detox, like Daniela's talking about, that she puts her patients on periodically, this is not a do-it-yourself. I would not get a book or go look at Gwyneth Paltrow's website or whatever and say, I'm going to do a detox. This is how I'm going to do it. I think all these great detox lifestyle practices can be part of our normal health routine. But when it comes to doing a formal detox, that's when I'm going to turn it over to Daniela to tell us a little bit more about like what would go into a formal detox that your doctor might oversee, compared to just, hey, do some good detox practices.
I couldn't agree with you more. And I don't think everybody needs a detox if you don't have the symptoms of toxin overload, if you're healthy, if you normally exercise, your sweating is okay, you go to the gym and then you spend some time in the steam room or in the sauna, you eat healthy, because eating healthy is a huge, very important thing. And more importantly, well, in addition to that, you also look at what you put on your skin, and you use clean products for skincare and for makeup. And there is actually an app. That's why I was looking at my cell phone earlier. I was looking for the name of the app. It's called Think Dirty, and it's really wonderful because it tells you on a lot of things. Over 2 million products I think they have on there, from shampoo, conditioner, lipstick, chapstick, everything you use. It will tell you not only the number that they give it, because they score things by how toxic they are, but also why, which is really, really important, because it gives you an idea about which specific ingredients that they use are the toxic ones. And you'd be surprised. You don't have to go really expensive to get some good, clean products. For example, Burt's Bees have, and I don't have any, disclaimers or anything on that, but it was just surprising to me that it was one of the cleanest lines out there, while some other things that I used to think of as being very clean, I was surprised that they weren't. So yes, doing all these things on a day-to-day basis, eating healthy foods, drinking lemon water and celery juice, and all these things, absolutely. And if you do all those things, you may not need to do a formal detox. But of course, the patients that I see are the ones that do need formal detox. And in order for me to know what I'm talking about, I actually went through it myself, and then decided, wow, this is actually really nice. And I like the way I felt afterwards. It jumpstarts weight loss if you're interested in weight loss. So it does have a lot of benefits. Plus, it really allows your liver to start working better. So when I do formal detox, I use very specific products. I don't like it when people call it a cleanse, because the products that I use have very specific ingredients that target those phases of the liver detoxification, and they detoxify the liver and the gut. So, and they absolutely need to be physician supervised, because like you said, if it happens too fast, if you don't drink enough water, if you're not having bowel movements, if you're feeling sick with it, I need to know about it. Because if you have too much die-off, I need to add a binder to help kind of clean that up and mop it along. If you're constipated, we need to increase magnesium, we need to add aloe, we need to do certain things to help move things along, so we don't get stuck with those toxins in there. So there's a lot there's a lot that goes into it when you undertake a formal detox. And I usually spend a full session with my patients explaining to them what to expect from the detox, what to look for in the detox, what to let me know if something happens during that detox. And a lot of times, we do the detox and then we look at some of their symptoms, and it's always so rewarding by seeing how many of those symptoms improve just by doing that 7 or 10 day detox.
Mm-hmm.
But it's not an easy thing. It's tough.
Right.
Yeah.
I want to kind of jump into our live Q&A, because we do have a lot of questions that I think are all related to kind of what we're talking about right now as far as detox protocols and everything like that. We have one viewer I have Hashimoto's and non-alcoholic fatty liver, but I also have high cholesterol, brain fog, excessive fatigue, and leaky gut. Besides supplements and lymphatic massages, where do I even start in our healing journey? Which Dr. Gerard, you talked about gut health, and then she proceeds to go on. But what does start with gut health mean? What would be step one for gut health? I mean, I think that's a lengthy answer, but in general, what are some guidelines as far as what can people do to help their gut health if they're experiencing, let's say, leaky gut?
Oh, that's a very lengthy answer. Easily there the gut repair has a certain protocols that you actually follow certain steps where you remove some of the things that damage the gut, and then you repair, and then you re-inoculate with the good bacteria. And depending on what part of the gut is damaged and what kind of damage. Is it inflammation? Is it metabolism? Is it digestion, like digestive enzymes? So there's a lot that goes into it, and it's very individual. And that's why, doing the personalized medicine is so important, because everybody's different. So where you start with the gut health, kind of depends on your symptoms, depends on how you got to it, to the problem. So it's a pretty complex questions, but you want to see a functional medicine or an integrative provider to look more into that, especially if you're having all those other problems. I mean, managing the thyroid is the thyroid, which is what we do at Paloma, is one part of it that's very important, but it goes much. If we're having all these other symptoms, then you probably need somebody to look at the whole picture.
Good point.
We have another question here, and I know this is a hot topic just in general, but I think specifically in the thyroid community. Can you guys talk about the correlation between like mold toxicity and how that can impact your thyroid health?
I can certainly talk about that. I mean, mold is a toxin. Mold is a form of fungus. And like any kind of overgrowth of certain toxins that we can react to, if we're overexposed to it, and when we look at where are people getting mold exposure, they're getting it from bathrooms, they're getting it in kitchens, they're getting it after damage to their homes that's causing mold even inside the walls. There's a certain degree of mold out in the environment, leaf mold, during wet and rainy seasons and things. So there's a lot of different ways that we can be exposed to mold. And it doesn't have to be that toxic black mold that everybody talks about. It can also just be household kitchen mold or bathroom mold. And if there's enough of it, and if you have a sensitivity to it or an allergy to it, or you're just exposed to too much of it, it creates that toxic burden, and it overloads your body's ability to process. If when the amount of toxin comes in exceeds the body's ability to process it and get rid of it back out, that's when it can become a problem. So one of the things with mold is we want to look at any exposure to molds and things. And then there's the related sort of sister issue, which we touched upon a little bit before, which is the candida, mold in our diet, the various mold in producing foods, like some of the yogurts and fermented foods, which are so good for us on some levels, can be a problem for people who have a sensitivity to mold or candida and yeast overgrowth. So we're looking at different processes and issues there. But it's also important to know that thyroid patients do have a tendency to be more sensitive to mold and to be sensitive to yeast and other components like that overgrow. And one of the areas we see that is chronic sinus infections as well. So if you have a chronic sinus infection, that's a good sign that you want to take a look at some detox protocols and go find a great doctor like Dr. Gerard, or work with Dr. Gerard if you're in her state, and get into some detox protocols that can really get some of these elements under control.
So from my perspective, the detox we're talking about here is completely different than the liver and gut detox that we were talking about before, because mold is essentially an infection. So it's a foreign organism, and as is candida, that the body is exposed to, so the immune system reacts to. So it's going to increase, it can potentially increase autoimmunity once that immune system is running off and becoming overactive. So mold illness is also called chronic inflammatory response syndrome, or CIRS, if you've heard of that. So that is a whole different issues that is, some of the detoxification ways that we were talking about doesn't really work for mold. So, the detoxification for mold is going to involve a lot of uh, decreasing inflammation and decreasing infection. So you're actually the treatments, while you're going to do all these other detoxifications, you're going to do to also address the infection part of that.
Awesome. We had a question. Dr. Gerard, you spoke earlier about liver health, right? And that helps with the conversion of T4 into T3, the active form. So can you give some clarity to people? Because I know a lot of people are on T4 only based medications. And sometimes they feel like that doesn't work good for them. So they want to switch over to a combination or a T3, T4, and DT based medication like Armour Thyroid, for example. Can you kind of give some clarity? Could it just be that simply maybe they're experiencing a sluggish liver, and if they work on their liver, could that T4 medication actually help them? Or is it true that maybe just in general their body doesn't convert well regardless of the liver state and they need more of a combination based medication approach?
Yes. so so it's it can be either. So like most things in medicine, it's there's no clear answer. So the thing is, if depends on what's causing the liver to not be able to convert the T4 to T3. The thyroid is also one of the main organs that converts the T4 to T3. But if the thyroid is sick because it's being attacked by the antibodies, especially in Hashimoto's, then it doesn't do its job properly. And then the liver, if it's a toxin related and a high burden on the liver, then it can be that. However, there can also be genetic issues where the thyroid does the conversion of T4 to T3 differently than the liver does and differently than the brain does. For example, they have different what's called deiodinases, the things that take the one iodine to make it from a T4 to a T3. So those are different forms of the enzyme. So there may be a genetic defect in the peripheral one, in the one in the liver, and if you had a good thyroid you would still be okay. And so again, there are nuances to this. So if the main problem is toxin exposure, if it's something that was developed late in life, they're only on T4, they're not feeling good, they used to feel good on T4, then it probably means it's not a genetic thing. So then you do want to do that detoxification to give the liver the best working chance, see if that works. And if not, there are other ways that we can look where we can add the T3, we can switch to a different product. So there are other options, but that would be definitely something that would be worth a try.
Mary, you kind of talked about yeast overgrowth and candida. We have one question here saying, how do you know if you have candida and how do you get rid of it? Oh, Mary,
you're muted.
I'm sorry. Big question. I mean, there are some tests that you can do to identify candida overgrowth. Oftentimes there's stool tests. They're going to look at some of the bacterial and overgrowth components that are going on in the stool that can help pick up some of those issues. How do you get rid of it? That's it can be a really like multifactorial protocol when somebody has candida overgrowth, yeast overgrowth. We look at dietary changes to minimize the exposure to yeast and foods that are going to help promote the growth of the candida. There are medications that are useful. There are supplements that are useful, and probiotic in some cases. I mean, there's a variety of different things, and that's again one of those not do it yourself protocols that I would say talk to a good functional medicine or integrative doctor who can walk you through the normal steps and the best things to make sense to take you to the next level with this, because again, this is one of those situations where certainly you want to get rid of it. You don't want to create a massive, symptomatic die off quite as quickly. You want to do it a little bit more gently. And you want to know what you're doing, because some foods are going to be a problem, some supplements. You also want to be careful about certain kinds of, everything from condiments in your kitchen and things are all going to have potential to make the problem worse or better. So I think this is one where we definitely want to walk hand in hand with a smart practitioner to guide us.
I think last question will probably today take for today, and then we'll go ahead and wrap up. Can one of you ladies kind of talk about, I guess, the importance of why you say like makeup and like skin related products can really impair our thyroid, but just detox pathways? Like why does it do that, I guess you can say? And what can they look for? I mean, you mentioned the Think Dirty app. So what are other ways that they can start cleaning up, or I guess some ingredients that can impair those functions?
Well, I can start out, and then Dr. Gerard can fill in the gaps here. But I mean, just think about it. You get up in the morning, and I mean, and we'll go a little. I'm going to go a little beyond the skincare issue. But you get up in the morning, and you've been sleeping all night in a room with a carpet that has Scotch Guard on it. Okay, and that Scotch Guard is an endocrine disrupting toxin that starts to affect our body and build up in our system. So you get up and you go into your bathroom and you brush your teeth and have a glass of water. Your water's full of fluoride. And your toothpaste is full of triclosan, which is an antibiotic that's toxic to the thyroid. Okay. Then we get in the shower and we use shampoos. They have various fragrances in them that have phthalates and things that can affect our endocrine system. Then we come out, we put lotions on, again, full of fragrances, parabens, all sorts of toxins that are going to be soaking into our skin, or we're inhaling through various fragrances and scents. Then we go downstairs to have our breakfast, and we're putting in toaster waffles and all sorts of things that are processed. They have we might think we're being healthy, but we're eating GMO, genetically modified soy, which can have toxic, can be considered a toxin. We're eating foods that have hormones and pesticides in them. Then we're going outside and we have soil that has been years of lead and asbestos and all sorts of things that are in our air and in our soil. And, it's just an ongoing, nonstop process of constant exposure. So the makeup, everything from the makeup we put on to the nail polish to the power bar we eat as a snack in the afternoon to, the air freshener in the car when we're driving home. All of these are toxic exposures. And when you start adding them up, might seem like, oh, an air freshener is not that big a deal. But when you're adding that on to the 25 other things that you're toxically exposed to every hour of every day, it starts to add up. So that's my pitch on it. Dr. Gerard, I'm sure you have some things to add to that.
No, that's absolutely true. So basically, there are a lot of chemicals. There are a lot of things and fragrances, especially, are some of the big ones. The synthetic fragrances, in a lot of these products that are on the Think Dirty list, and you see them in the higher range of toxicity. A lot of them are because of fragrances. So what you want to look for mineral makeup. You want to look for truly organics that are organic certified and not just say organic, because the rules of who can say organic and what that means are very blurry. So you have to make sure that what you're using is actually something that's certified organic. And there are a couple of companies like Cosmos and EcoCert that are some of the best certifying bodies that actually go down to the seeds and make sure that everything, that all the plants that they use the extracts from in this specific skincare are actually grown organically, without pesticides, without herbicides, without so many of those toxins that you are talking about. The endocrine disruptors are some of our biggest enemies. The phthalates, the bisphosphonates, the glyphosates, the dioxins, all these different chemicals that are being used by the cosmetic industry. um, it's kind of tricky because when you buy some of these preservative free, they don't last as long. They're not going to have as long of a shelf life. So there's always a price to pay. They're going to be more expensive because it's a lot more expensive to produce. And and their shelf life is not going to be as long. So there are specific lists. For example, for fruit and vegetables, there's the Dirty Dozen, which tells you the ones that you do want to look for organic. The thicker the peel, and if you get rid of the peel, then it's okay to not use organic for some of those things. So you don't need to spend the extra money. The ones that you do, is very important that you wash them not only with water, because some of these things are not water soluble, so they're not going to come off. So, there are specific things that you can use to wash them, and like the fit. And I use vinegar a lot. I let them soak in water with vinegar, and then I soak them a few times in water to get rid of the vinegar smell. um, there are more and more, actually, I'm seeing more and more organic and fluoride free toothpaste. And so the industry is catching up slowly, but it's also tricky. So you really have to kind of know your ingredients or Google them, because there's an awful lot of information you can find out. Not all of it is accurate, but some of it is okay, where you look things up. But they're tricky because they may not have the bisphenol A, but they'll have the bisphenol B, and which is a little bit better, but it's still a bisphenol. So or it may not be high fructose corn syrup in some of the things that you eat, but it will be corn products. So you have to kind of see, what do they mean by that. So you just have to have the awareness and to look for those things and try to avoid them. Can we avoid them completely? Absolutely not. That's why, and our body is equipped with a lot of things that it can get rid of a certain amount of and handle a certain amount of toxic material. But again, when it becomes too much and it becomes overwhelming, that's when we start running into problems.
Great. Okay, ladies, I think that's it for our live Q&A. Thank you so much for all of that insight. I mean, I feel like just detoxification in general, we can go into so many lanes about each organ system and everything like that, and we can really go into those functions. And obviously, we don't have time to go into that today. So I think today's conversation was really, as well-rounded as we could be, about giving you just an idea in general of just the different functions and what areas you can really focus on. Dr. Gerard is a provider at Paloma Health. So if you would like to work with her and see if she is available in your state, all you need to do is go to palomahealth.com and you can book an appointment with her. And Mary Shomon, she is on Instagram and all the things under Thyroid Mary, correct, is your handle, right?
Yes.
And you can check out her website. Everything's going to be listed in our description, and you can find all of her books and everything on her website as well there. So yeah, if you have any other questions for us, feel free to leave questions in our community page, and we can go ahead and try to get back to those as soon as possible. And again, if you aren't familiar with Paloma Health, we can, like providers like Dr. Gerard, see you from the comfort of your own home. So all you need to do is become a Paloma Health member, and then you can book appointments with lovely people like Dr. Gerard, and you can set up nutrition visits. So for example, let's say you're experiencing leaky gut, like we talked about earlier, that might be something that doing an AIP protocol would help to do, those elimination foods and everything like that to help heal that. And our mobile app also has an AIP protocol that can help kind of walk you through that, as well as, you could work with a provider like Dr. Gerard. You could book a nutrition call with our registered dietitian, and they can really walk you through those processes in general and really support your thyroid health in, like I said, a whole body, well-rounded way. So again, thank you so much for tuning in. It was really great. This was Detoxification, Immune Health, and your thyroid. And I hope you got as much out of it as we were able to provide. And again, thanks so much for tuning in, and we'll see you guys next time.